Now we're going to see the pancreatic secretory tumors. This will be glucagonoma, insulinoma, and somatostatinoma, and Stillinger-Ellison syndrome. Alright, first with glucagonoma. In glucagonoma, there is increased secretion of glucagon by the tumor in the alpha pancreatic cells. The alpha pancreatic cells secrete glucagon, so the patient will present with increased glucose. This will lead to a diagnosis of diabetes mellitus, so maybe the patient comes with a recent diagnosis of diabetes mellitus. The patient will have dermatitis, the necrolytic migratory erythema. Sometimes they have diarrhea and depression. And certainly, due to the tumor, they will have decreased weight. So, the patient will recently come by a diagnostic, recently, let's say 2 months, of diabetes mellitus, and now is coming, let's say, for the diarrhea, and we see the necrolytic erythema. The treatment is surgical removal. We can give octreotide to inhibit the glucagonoma, or the glucagon secretion. This is the glucagonoma, and just remember this: diabetes mellitus, dermatitis, that is the necrolytic erythema, diarrhea, depression, and decrease in weight. Now, the insulinoma will present with signs of hypoglycemia that are decreased glucose, signs and symptoms, usually symptoms of insulinoma, of hypoglycemia, and the resolution of symptoms after glucose level come back to normal. This is Whipple triad. First step is to measure the C-peptide in order to see if it is a insulin that comes from the pancreas or exogenous. After this, we will measure the sulfonylureas. If we see sulfonylureas, we will put an antibody, and if in the urine we find that the antibody was bound to the sulfonylureas, it was sulfonylureas. If not, it was insulinoma. Now, the best initial test is the C-peptide. The most accurate test is fasting for 72 hours, and this will show a hypoglycemia with non-ketosis. There will be no ketones. We should not find the sulfonylureas antibody, and we can do some other laboratory studies to see the potassium. There will be hypokalemia due to insulin putting potassium inside the cell, so we will see hypokalemia. So the best initial test is the C-peptide. The most accurate test is the fasting and sulfonylurea test, hypokalemia, non-ketotic, etc. Next, and the treatment is surgical removal, sometimes with the Whipple triad, with the Whipple procedure. Now, the somatostatinoma is a tumor that secretes somatostatin. This is a tumor of the delta cells of the pancreas, and remember that somatostatin decreases or inhibits the protein cholecystokinin, gastrin, secretin, insulin, glucagon, and gastric inhibitory peptide. So due to the inhibition of cholecystokinin, the patient will have gallstones, acute cholecystitis, statorrhea. Due to decrease in the glucagon, the patient can have hypoglycemia, but due to the decrease in insulin, the patient can present with increased glucose, with diabetes mellitus, so could be either one of those. Decrease in gastrin leads to acroridria, etc. The treatment is surgical removal, and for symptoms, is octreotide, the antagonist of somatostatin. Next we have the Stillinger-Ellison syndrome. Stillinger-Ellison syndrome is a gastrine tumor. This gastric tumor is called gastrinoma, and this tumor could be in the pancreas, could be in the intestine. Usually in the pancreas and secretes gastrin. Gastrin increases the secretion of chloric acid, and this would lead to ulcer. There will be ulcer and usually are distal to the duodenal bulb. The Zollinger-Ellison syndrome presents with intractable ulcers. The treatment is surgical removal, but if there is metastasis, then just be PPI inhibitors, the proton pump inhibitors. The test is to do the secretin test. When we secretin inhibits gastrin, but in this time we will see no inhibition. Instead, we will see increased release. Zollinger-Ellison is diagnosed when we have more than 200 picograms per milliliter of gastrin, and we should be careful with any pancreatic tumor. Let's check the familial history for MEN1, hyperplasia of the parathyroid glands or adenoma, pancreatic tumors, or pituitary tumors.